All year round, Frontier Home Products and Design has what you need to make your home comfortable and beautiful. Relax on a new timber tech deck designed by Frontier's experts. A new fireplace from Frontier Home Products Fireplace Gallery adds warmth and serenity to any home. Beauty and versatility at Frontier Home Products and Design Center, 4213 Peachtree, East 5th, next to the Bayfront Highway.
Frontier Home Products and Design Center. Discover a new frontier.
PA contractor number PA039007.
Quickfill gasoline is made right here in America. United Refining Company, who operates Quickfill, refines its gasoline from North American crude oil in Warren, Pennsylvania. When you buy United Refining Company gasoline at Quickfill, you keep jobs and businesses in America. And you keep American families strong. You don't need to send your money overseas when you buy gasoline. Buy American-made gasoline at Quickfill. Quickfill, driving America.
Welcome to TalkErie.com's Joel Natale Show, Erie, Pennsylvania's daily podcast. Every day, we tackle the biggest issues that the Erie PA region faces. Stay informed and involved as we advance the narrative of Erie. Now, here's Joel Natale.
With us here from the Erie County Health Department is Erin Mrenak. She's the executive director. And Erin, it's a busy day for you, isn't it?
It has been a very busy day today, yes.
Welcome back. Good to see you. We had booked you because we're like, let's get an idea on what kind of flu and respiratory illness disease, kind of year it's been, because it feels like everybody and their brother has gotten something, right?
Yes, we had a very significant number of cases for flu and COVID and RSV this season.
Yeah, and including hospitalizations and so on. But little did we know that this morning the health department released that 2 measles cases have been reported now in Erie County, which is a first since 1991.
That's correct.
Okay, so what is the measles? Can you give us some of the public health perspective on all this?
So the measles is a highly contagious respiratory virus. It can be spread through sneezing and coughing, but measles also can linger in the air for up to 2 hours. So if you could walk into a room and there could be no one in there, if someone was in there that would have had measles, you could potentially get it from just breathing in the air. It lingers for 2 hours on surfaces and in the air.
Unreal. And so this is why, we have airplanes that have HEPA filters cleaning the air every 20 minutes
Correct.
or so, just to be able to knock that out. And what can you tell us about the cases in Erie County?
So we have 2 confirmed cases. One is a lab confirmed case, and the other one is considered a confirmed case because of the epidemiological links. It's in the same family. And we received a phone call and really just talked with the family and got the information. And when we heard there was a rash present, we actually went to the family's home and we did the testing there. And then we worked closely with the State Department of Health to get the lab couriered to the Bureau of Labs, which is in Harrisburg, so that we could get the sample done in less than 24 hours. And while that was going on, our team does a full disease investigation. So we have questions and a process that we go through with the family to identify any possible contacts or any exposures that someone else in the community might have had. And in this case, we're very fortunate that the family handled this perfectly, and that as soon as they had learned that they had an exposure, they quarantined themselves in the home and hadn't left and hadn't had contact with anyone outside their own family.
That's really remarkable.
It is remarkable.
What was the term in COVID? The whole close contact thing, right? I mean, that's your disease investigation. Standard procedure.
Yeah, we do close contacts, and then with measles, because it's so contagious, we look at people who could even had exposure because someone would have been in a location. So in Montgomery County, there were 2 cases earlier. I think last month they came out. And that individual had been in a train station, or if someone had gone to the hospital and people didn't know that you either had measles or went and didn't give the provider a heads up, you could expose potentially that entire waiting room full of people. And anyone that is unvaccinated is very, very susceptible to getting measles, even from that limited exposure, because it's so contagious.
Yeah, let's talk about a level of alarm. Just because there are 2 people present with current measles, considering the vaccination rate over the last 50, 60 years, more than likely either you've had it a million years ago or you've been vaccinated against it, right? With those 2 courses, right? You have one as a baby at 12 months and then one at 4 years. Can you go through all that for me?
Yeah, so the first dose of the MMR, and now there's another version called the MMRV, which is including varicella, which is chickenpox. So kids now sometimes get all of those in one dose of vaccine, which is nice. So the first dose happens between 12 and 15 months of age. And then the second dose happens between 4 and 6. So usually it's before kids are going into preschool or kindergarten. So babies under the age of 12 months are very susceptible to measles because they will typically have some immunity from mom, but it starts to wane as it gets closer to 12 months. So babies that are unvaccinated are more susceptible to catching it at that point. So I pulled the vaccination numbers from 23-24. That's the most current that are on the state's website. For kindergartners, last year, our vaccine rate was 94.9, and herd immunity is considered at 95%. So we're right on that bubble, which is really good.
We're talking about Erie County or
Erie County,
Pennsylvania? Okay.
Erie County. And the percentages range from across the state, but if anyone's curious, all that information can be found on the State Department of Health's website, and you can look by county if you'd be interested in that.
Okay. Yeah, I'm interested in Lancaster County. I'm just not for any reason, but you hear these stories, these narratives that there are certain people groups that have decided to not vaccinate their kids.
There are some, and Pennsylvania does have different types of exceptions that people can utilize for different vaccinations for different religious beliefs, philosophical beliefs, or potentially medical conditions that would preclude you from getting them.
To go from 1991 to 2025, I mean, we're talking 34 years without an actual recorded case. Now, that doesn't mean one could have slipped by, but more than likely, it didn't happen for 34 years.
Yeah. The vaccines for MMR are incredibly effective. So keeping those vaccination rates high are what have allowed us to enjoy large periods of time without having active cases or outbreaks in our area and many other areas.
That's not even herd immunity. That's basically you're wiping out.
Yeah, it was considered eradicated for a long time because there were so few cases nationally.
And what do you think has changed here in the last couple of years?
I mean, I think with COVID, people's beliefs about vaccines in some cases have changed. There's so much information, good and bad, available for people all the time. I just really encourage people to get your information from multiple sources. It's really important to read studies and talk to your healthcare provider to make the most informed decisions about your healthcare.
Talk about one of the complaints I've heard about the vaccination schedule for young children is that they've just kind of piled it on much more than, let's say, when I was a child or even when my children were young. That there's something about this current, I mean, I've heard up to like 90 different doses of vaccine over the course of 6 years.
And I will be honest, I am not one of our immunization nurses, so I can't speak to that today, but we could definitely follow up with one of our immunization
But have you heard that complaint as well,
I have heard that complaint as well,
I mean, is there, I mean, it should be between a patient and their doctor, right?
It should.
About timing and stuff and volume.
But there are so many physicians that participate in the reviews of those when they're looking at the schedules for those vaccines. It's not just one person making that decision about what that vaccine schedule should look like. It truly is looking at what's the most effective way to prevent those diseases, because young children are very susceptible to those. So they're kind of doing a cost benefits analysis with that.
Okay, so no matter if it just seems like a lot, I mean, there's a lot of research that's going behind all this.
Absolutely.
Yeah. I mean, it is pretty alarming, to have a big change after 34 years. What do you think is going to be, the standard operating procedure going from here on out? Do you anticipate, like, for example, having to restart a measles awareness camp? I don't know. Like, what are the discussions of public health going to surround about this?
We've been working closely with the PA Department of Health since this process started. We didn't have any information on our website about measles because we hadn't had to. So we today put up a measles information page, an FAQ. Last week we sent out, and this was before we knew about these, we put out the PA Health advisory about measles, which just, again, was for healthcare providers. So they know, okay, let's talk about what to look for, because a lot of people practicing have never seen measles before. We don't have anyone working at the health department right now that had experience with measles the last time we had cases in Erie County. So we pushed out as much information to healthcare providers so they know what to look for. Today, the State Department of Health had a call for clinicians across the state where they heard a presentation from experts at the State Department of Health. They could ask questions talking about staffing and immunizations and maybe how to isolate a patient if they were coming in with suspected measles. So it was a really great tool for folks to use when they hadn't necessarily seen that before.
Okay. I know there are very specific definitions on what constitutes different levels of disease in a community. What is considered an outbreak?
So an outbreak, to my knowledge, is it has to be more than 3 cases. It's not
of measles.
Yes.
That seems very small.
It is very small. But there are some conditions about how those cases are spread out.
Okay.
We are not in a place where we're meeting any of those definitions.
Gotcha.
Yep.
Again, you were able to identify 2 cases within one family.
Correct.
After this very specific, again, it's been reported, international travel. And do we have a sense on measles internationally? Like, is it more prevalent in foreign countries than the U.S. maybe?
There are places where vaccine aren't as available.
Yeah.
So measles outbreaks are not uncommon. So if you're traveling to any of those areas, it is recommended that there's always online resources that you can find where there's measles hotspots. So if you're traveling to areas where measles is more prevalent, checking with your doctor, checking your immunizations records to make sure you have all the appropriate vaccines for those areas is important. I know a lot of people that travel end up getting some additional immunizations before they go. Diseases that we haven't had to worry about in the United States for a long time are very prevalent in other parts of the world.
I mean, you think about when you go to, if you go on a missions trip or something to, Africa or wherever, you're getting a malaria shot or you're getting it sounds like, if there's a measles hotspot, and obviously these 2 were unvaccinated, or is that obvious?
So one individual was unvaccinated. The other one was actually partially vaccinated.
Okay.
So they had had 1 dose of vaccine. So 1 dose of MMR will give you 93% protection against measles. So that's still pretty high, but there's always a percentage when you're in close
7%.
contact with someone that you're living with that you could potentially still get a case of measles, and that's what happened in this case. And then a 2nd dose of MMR takes you to 97% immunity. But again, when you live with someone and you're constantly being exposed to that people are infectious for 8 days during that rash period, and you live with someone, it's more likely that you would be exposed.
I feel like after 5 years ago, after COVID, we all became armchair epidemiologists. Like, we know kind of how this goes. I want to get to some of the other respiratory illnesses. In your estimation and from the data that you saw, how bad was it for influenza, RSV, COVID, and all the other stuff this winter?
Yeah, we saw record high flu cases a couple weeks this
record
season
high
for flu A. Yes, flu B we have not seen much of.
Okay,
but
flu B is the stomach one?
No, flu B is just usually a more severe respiratory disease.
Okay.
They can both have some GI issues coming along with it.
Right.
But flu B often hits later in the season, so we may not be out of the woods with that yet.
Okay.
So it's still important to monitor symptoms and talk with your doctor if you're not feeling well.
Yeah, I feel like an idiot this time because, like, I've gotten a flu shot every year for like a decade, and I didn't get one. And darn it, it knocked me on my tush, if you will, this year. And, it's kind of hard to shake. There's a lot of people that are just coughing.
Yes. And it's been lingering, and COVID cases were also very high. And again, we get some cases reported into NEDS, which is the disease surveillance system that we use to monitor infectious disease. when the emergency declarations for COVID went away in Pennsylvania, COVID was no longer a reportable disease. So there are some healthcare providers, if they're testing for COVID, they still put that into NEDs. So we do get some cases, but it's not necessarily an accurate reflection of what's going on in the community. So we used our wastewater data, and it showed peaks as high as when I actually came into this job during Omicron, where we were seeing like 800 cases a day, and we had all those people coming in for testing clinics. So numbers in the wastewater were very high for COVID, and it hit at the same time we were seeing all those peak flu cases. So,
and you're able to test for flu in the wastewater.
Yes, we're
too.
testing for flu A, flu B, and RSV, as well as COVID in the wastewater. Yeah, it's been a really good surveillance tool for us.
That's remarkable. And you're saying that there's that much COVID out there, that just like the Omicron outbreak then. Yeah. Jeez. So is this going to just be a thing? Like
respiratory disease?
Yeah.
Yeah, I mean, it definitely ebbs and flows, and we'll, as we get more years worth of wastewater surveillance data, we'll be able to better kind of analyze that. Last year, we didn't have that tool available until we had already peaked for flu and RSV. Okay. So we're not sure what our numbers would have looked like with wastewater last year, but we did have higher case counts this year. Influenza and RSV are both reportable diseases, so providers are required to report on that into the system every time they have a case.
What as a public health, again, prevention is number one. Is there any pro advice on maybe not being just kind of jumping into this pool of virus in the wintertime? And what can we do to
healthy lifestyle helps the healthier you are as a person. So healthy diet, exercise, managing your stress, proper sleep, all of that plays into how well your immune system functions. Flu vaccines help. This year's match was estimated to be 40 to 60%, which is pretty typical for a flu vaccine. But it was just very infectious this year, and it spread quickly, and it was causing some pretty severe symptoms for people. So good respiratory disease precautions. Hand washing is always good. If you're in large crowds of people, you could consider wearing a mask. If you are in a place where you can have better ventilation with a purifier, or if you can crack a window if you have people over, to just let that air circulate a little bit so there's not virus lingering in the air, those are all strategies you can use.
What about the idea that, somebody brings it into the house and then it just goes through the family? There's not a whole lot you can do about that, can you?
No, if you have a house that's set up where you can kind of in-home keep the person who's not feeling well a little bit separated from the rest of the family, you may have some success with that, but a lot of times it's really difficult to prevent. So again, getting those vaccines, and again, a lot of them, there isn't a treatment that cures it, but you're just managing symptoms at that point.
Are people still getting COVID boosters?
People are still getting COVID boosters, and they will be
are they at all effective, you think?
They have been, because most of the strains of COVID that we've seen for the last 2 years have been descendant from Omicron, so the vaccines are effective against those. But COVID mutates so quickly. Even it's a lot like flu. Sometimes it's mutating 2-3 times a year still. So we don't know if this is going to be the cadence with COVID. We don't know if it's ever going to switch in a way where we're seeing more serious respiratory diseases caused from it.
It's interesting because one of the unfortunate things, it just is at what it is, but all of the resources that we had, as far as free test kits and, or even going through a drive-through testing, that's kind of all gone, right?
And we do still have, if people call the health department, we do still have some point-of-care tests that we can distribute. So we have people that call, and we'll give them a little kit with some masks, hand sanitizer, and a couple of at-home tests enough for their family if they're concerned. So we do still have some resources for that.
Oh, that makes a lot of sense. The as we go into the spring, now we're getting into allergy season. People are still kind of lingering with their cough. They could get a whole other onslaught of histamines, and just more nasal flow and the whole shooting match, right?
Yes. Lots of mucus happening this season, yes.
That's remarkable. What were you guys working on, before this measles breaking news dropped today?
So we are in the middle of our community health needs assessment. This will be the first one that we've published since before COVID. So we have had a lot of lessons learned in public health since COVID that we're still applying as far as preparedness and We've done a lot to improve the data that we're putting out to the public. We have some new dashboards that are available on our website. We have a respiratory disease dashboard that shows wastewater information for all those diseases I mentioned. We also then show case counts, hospitalizations, and deaths on there as well. So that information is publicly available. We also have done a pretty lengthy survey process for about 6 months to gather data on a lot of the health concerns of our community. It's a survey people could fill out. And then we also conducted some focus groups to get some qualitative data. And we're in the process of evaluating that, and we're hoping to have that out by midsummer at the latest.
You're just trying to ascertain from the public what are the felt needs?
Absolutely.
Okay.
What are they concerned about in their community? So there were sections about behavioral health, so mental health or drug and alcohol. We had sections about chronic disease. We had sections about smoking. We had tried to hit all pockets of like what could be, how is your access to health care? Are your medications too expensive? We really wanted to get feedback on what was important to people. It helps us drive our work. So once we do a number of other types of data analysis for the community health needs assessment with the addition of that survey data, and then we'll publish the report. And from that, it helps us identify our top 3 to 5 public health priorities, and that will help us make our community health improvement plan, which is then, okay, where can we move the needle as a local public health department to help improve the health and wellness of our community?
How are you funded? Is this kind of a pass-through from the Pennsylvania Department of Health, or is this county council does an appropriation? How's this work?
So we're funded in a variety of ways.
Okay.
So we have some state funding, which is called Act 315 funding, which then our county matches 100% of what that is.
So 50-50
50-50. And those are for the services that we're required to have as a local health department. So we're required to have my position. We're required to have community health services, which is STD testing, tuberculosis, immunization, and those types of things, as well as all of our communicable disease work, which is all of our surveillance and disease investigations. We monitor 74 infectious diseases every day. So we go in, we have a team of people that's what they do. They go in every day. We do contact tracing. We provide education.
Wow.
So all that we do behind the scenes.
Get paid to drive. Start a new career behind the wheel at the EMTA. If you are looking for a high-paying and rewarding career with full benefits and paid training, stop by or apply online today with the EMTA. Plus, EMTA riders can now enjoy free Wi-Fi on new, clean, and environmentally friendly buses to travel all over Erie County. Visit ridethee.com for more information.
Get on board EMTA. Get on board EMTA. Get on board. From baggage claim to pajamas in 10 minutes. Erie International Airport. Fly with ERI.com.
Fly Erie International Airport to Charlotte on American Airlines, your nonstop gateway to the world. Also, we have Breeze Airways flying nonstop to Orlando and Tampa, Florida. Great low-cost carrier providing excellent service to the regional community. Fly Erie International for your travel needs.
Fly with ERI.com.
You have been called
to do good,
to feed the hungry,
to love with action,
to be a light in the darkness,
to love your neighbor,
to teach wisdom,
to walk humbly,
to love mercy,
to care for the least of these.
Will you accept the call?
This is our city.
Our mission.
Visit eriecitymission.org/volunteer to accept the call today.
Erin, I want you to repeat that this department is only one of 11 local health departments in all of the state of
Correct.
Pennsylvania. Wow. So, I mean, it's a blessing to be able to have this kind of, view of what is exactly happening at street level here in Erie County.
Yes, and we have connections to local partners and community organizations. So if there's a crisis or an emergency, there's a lot of ways in which we can impact positively the community. So that's one benefit of having a local health department.
Yeah. You were going through how you're funded, and you have kind of different buckets and different funders. What kind of federal money is involved?
So we actually only have one directly federal funded grant, and that's one of our environmental health grants, and that's for our Beachwater program.
Oh, okay.
And we've actually just received that fully funded recently, so that's been good. So we're fully funded for
since
the next
January
year.
20th?
Since January 20th. Yes, thank you for clarifying that. But we have gotten that in, and we'll be able, and that's what helps us monitor harmful algal blooms and E. coli on our beaches. So that's an important one.
And who's on? Is that from Health and Human Services?
That's from the Environmental Protection Agency.
Oh, from the EPA.
Yeah.
Interesting.
Yep. A lot of our other funding comes as their grants that the State Department of Health gets, and then local health departments are eligible for those funds. So our immunization grant, our HIV grant, we have a very small tuberculosis grant. Those are things that are through the state but come from federal funds.
We were talking earlier in the show about poverty, and Erie County unfortunately has one of the highest poverty rates in the state. Erie City is the most poor city of the major cities in Pennsylvania. Is there a correlation for poverty levels and public health poor outcomes?
Yeah, there definitely is. I mean, access to healthcare alone is difficult, and the poorer areas are not necessarily urban areas. Some of our rural communities, getting access to even go to a PCP regularly is sometimes difficult. There might not be an office open or an urgent care or something like that if you need it. So,
and driving to Erie to the urgent care is a
not
lot.
Necessarily practical for people, or it's very expensive. So those things can preclude people from getting access to the health care that they might need.
And so whether it is dealing with a wound that won't heal, or that nasty cough. I mean, it could just be any number of things.
Yeah, and then you could develop pneumonia where you're at a point where now you need to look at it, maybe a hospitalization, because you didn't get to someone that could have helped you get treatments for it a little bit earlier in your illness.
So by being, let's just face it, by Erie County being so poor, does that put extra pressure on the health department to do these strategic relationships, whether it's with the community centers or rural, I don't even know. We have rural health clinics, I guess.
Yeah, there are rural health clinics out there. I think telehealth has made a huge difference for a lot of people. It's just there are some people that are maybe a little bit older that don't embrace the technology as much. Yeah. But for some people, the ability to use telehealth for basic health care has made a huge difference in their access to care.
Yeah, and that makes sense to me. I mean, we do have Community Health Net, and that's a huge partner. You do have a medical director, right? Do. What is their role at the health department? Because they're not seeing patients through the health department.
They are actually.
Oh, okay.
Yeah.
Clarify that for me then.
So we have a health director. It's Dr. Anthony Snow is our medical director. He's been with us for a number of years. He works in our TB clinic and our STI clinic, and we'll see patients as we need to. He also acts as a medical advisor for us if we need medical information, advice. We also have our Board of Health, which is always required to have 2 physicians licensed to practice in Pennsylvania. We currently have 3. So if there's information that we need, we also have a really good relationship with infectious disease docs in the healthcare systems. So we're always in communication with those partners whenever there's an issue that comes up that we need to get information back and forth.
I remember at one point being able to get my child's shots at the health department. Is that still a thing?
There are certain instances where we can do shots for children. It's called the Vaccines for Children program, but they have to be underinsured or uninsured to be eligible for those.
It's not just a wide net.
Correct. There also is a small amount of funding through 317, which are for adults that are uninsured or underinsured, where we might be able to help provide basic vaccinations.
Okay. Interesting. Again, what the public health, infrastructure is responsible for, can provide, is kind of changing. I mean, your predecessor, I remember talking to Melissa about, public health 2.0, the idea that it's more of a whole health approach, right? And that was well before COVID. We had no idea that a pandemic was coming down. There are things that you guys are contributing to on behavioral health, mental health, about smoking cessation and maybe working on the diabetes epidemic and things like that. Can you talk about some of that?
Yeah,
stuff?
so we have some smaller initiatives where we work on health and wellness to prevent chronic disease. So we're active partners with the American Heart Association. We do our Step It Up program annually, which is kicking off soon. If anyone wants to get a team together, it kicks off on April 7th, which is also National Public Health Week. Those always correlate. So that's coming up soon. We look forward. People seem to really enjoy that. We have good participation across the county for that. We also have some initiatives, and less so with diabetes. We've partnered with Safe Harbor for some suicide awareness campaigns. We work actively with Birthroot, which is a company that provides doulas for underprivileged women. And we've had a great deal of success with that program, be able to do some great things. So we have a pretty diverse pool of activities that we're doing in the community.
Yeah, people need to understand the doula thing is, it's all about prenatal and birth and postnatal.
Postnatal, correct.
I mean, that's how you have a healthy babies by going, seeing the process all the way through.
And then healthy moms afterwards to make sure that they're getting the care that they need.
Yeah. What as far as summer initiatives, what's typical for you guys?
So summer is our busiest season with most of our environmental health.
So you're checking out stuff.
Inspections with pools, all of those things happens in the summertime. We also do all the temporary licensing for food events. So our inspectors are very, very busy in the summertime. It's also tick season and mosquito season. So we will usually put some public health information out about awareness for ticks, Lyme disease. We start to get interview requests this time of the year about that stuff as well.
Are you doing the E. coli checks at the beach?
We still do that.
You do.
We'll have a new map up this year. We have some new technology that our staff are able to put information in the field from their surveys and get it directly onto the map. So that will change this year. We're going to have some new data showing with our food inspections too. So hopefully it's a little bit easier for people to access history of licensure in some of the restaurants.
That's kind of cool.
Yeah.
Talk about preparedness for the next big event. Of course, again, the breaking news today is the measles. But you almost have to always be ready for that big outbreak. It's literally out of the movies, and we lived it in COVID. So things like stockpiling PPE, and managing all that stuff, right?
Yep, we still have a stockpile that we're maintaining of PPE. It's mostly KN95s that we can distribute if they're needed.
It's personal protective equipment.
Correct.
Yeah.
There's also some other more serious gear if it would be needed for something like the shields and the suits and all of that. We also invested a lot of our COVID money in data improvements so that we can better get information out to the public, analyze faster, utilize dashboards so the information's easier to see and is a little more interactive for people.
Do you have to have an IT person on staff? Or?
Our epidemiologists actually are doing that. We've done a lot of trainings and they've really taken to the technology. So we've built some really neat processes. We highlighted with our hepatitis A response when that happened last year. We were able to use that technology to create a completely digital system from registration so we could see how long it took to get someone through our whole vaccine pod from registration. It was less than a minute per person. So we could see that live. We could make improvements to the process with the technology. So it's been a great tool for us.
How has it been for you if you need to communicate something to the public? What are the best ways that you've found? Obviously, you're on the news today all over the place,
several times.
But so that's kind of easy. But when you're talking about a hepatitis A, preventative medicine, or I would imagine with any sexually transmitted disease, if you're seeing that there's a contagion out there, you're going to want to communicate that different ways, right?
Yeah, so we use social media when it's appropriate to do that. Facebook is where we have the most followers. Press releases we put out to try to get information out there. We have kind of a blast fax system to healthcare providers. So we sent one of those out today with some information for clinicians. We sent those out last week too, so we can at least rapidly get information out to healthcare providers. Sometimes good old-fashioned phone calls are the best resource we can use, or we try to get to community leaders that can spread the message. We'll provide information if they're willing to distribute. We'll go out and have events where we can. So sometimes it's those grassroots efforts that gets us to where the people need it the most.
And you feel like the communication from primary care back to you works well too, or
it typically does. They definitely get a hold of us when they need to get a hold of us. We have nurses and nursing supervisors on staff that do a wonderful job with navigating all those healthcare related questions.
I was going to say, are there any positions open at the Erie County Health Department?
We still have nursing positions open. That's been our biggest difficulty in filling.
Like full on RNs, or
full on RNs. Yeah,
gotcha.
It's
and
been
what would they
struggle.
normally do?
Disease investigations. We have them open in our immunization program, our tuberculosis program. So our nursing supervisors are definitely working nursing supervisors. So they're seeing patients and really supporting the activities to allow us to continue to do those.
Wow.
Yeah.
Wow. It's amazing. Again, I think we knock on wood and say, okay, we don't have to have the public health conversation on a weekly basis like we did in 20 and 21 and even into 22. But I tell you what, it is always kind of bubbling under. You never know when you're going to need to do something.
And it's always a joke in public health that when it's going well, people don't know what you do. Because we're doing this is what we do. We do surveillance, we make phone calls, we connect people to resources. And when that's going well, we're preventing a lot of those things from spreading. And then you get something like a COVID where it's just so big and so contagious or so new that we get like a public spotlight on public health. So that's when all the money comes, and then it slows to a trickle when those things goes away. So for public health, establishing more consistent funding streams for us to allow us to maintain those levels of preparedness is really important.
Yeah, really, this will be my editorial comment. The idea of making sure that our legislators are keeping, an eye on this, that they're not forgetting or, disregarding this need, right?
Yeah, just because we're quiet doesn't mean we're not very busy.
Right. Yeah. Well, I'm thinking too, with the growth of, let's say, our restaurant and hospitality sector, you guys are getting busy with that. I mean,
yeah, we license over 2,000 entities.
Wow.
With our inspection team. So they do a wonderful job, and they're very busy.
Right. Well, I'll be on my soapbox again of, if we can go after some of these metabolic chronic disease that we have between, diabetes and overweight, obesity. I mean, I think it would just be a more healthy Erie County. We need to move more. Yeah. We need to
eat better, manage stress better, sleep well, all of those things.
Stop smoking. All those things allow our immune systems to function better. I totally agree. Yeah, Erin Mrenak, she is the public health director, and thank you for coming on a Breaking News Day. I know you're really busy.
Thank you for having me. I appreciate your time.
You've been listening to The Joel Natale Show, Erie, Pennsylvania's daily podcast from TalkErie.com. Subscribe to our show on your favorite podcatcher and get involved by emailing joel@TalkErie.com.